I'm Dr. Neil Skolnik, and today we're going to talk about the National Institute for Health and Excellence guidelines on the management of acne. This is important because we take care of acne all the time in the office, but it's not usually covered in traditional CME programs for primary care. Let's start with the basics, skincare products. Avoid oil-based moisturizers, makeups, and sunscreens. If you use makeup, take it off at night. Next, diet. Diet's talked a lot about, but the guidelines clarify there's no evidence showing that one diet works better than another with regard to treatment of acne. Let's move on to first-line treatment. It's important to understand that it takes about 6 to 8 weeks to see the effect of treatment once it's started, and a course of therapy is considered 12 weeks long. First-line therapy is no longer with a single agent. So we start with topical, fixed-dose, combination therapy, even for mild acne, and essentially we choose from one of 4 classes: benzoyl peroxide, retinoids, either tretinoin or adapalene, vitamin A derivatives, topical antibiotics. Topical clindamycin is recommended. No longer recommended is topical erythromycin because of antimicrobial resistance, or topical azelaic acid. Azelaic acid is a natural acid found in grains including barley, wheat, and rye that has comedolatic, antibacterial, and anti-inflammatory properties. So, first-line therapy is with combination of the above 4 classes, either adapalene and benzoyl peroxide, tretinoin and clindamycin, or benzoyl peroxide and clindamycin. You'll notice that none of them include a topical retinoid along with benzoyl peroxide because benzoyl peroxide oxidizes retinoids, making them ineffective. It's important to communicate to patients that all of the topical agents can be irritating, so start by putting it on either every other day or just for an hour, then washing it off until tolerance develops. Also, the topical agents can cause phototoxicity. Worth telling patients about. Use sunscreen. Also worth mentioning is that benzoyl peroxide can cause bleaching of hair and fabrics, including pillowcases. For individuals whose acne is a bit worse, it's reasonable to add an oral antibiotic. So you can use adapalene benzoyl peroxide combination topically, along with a tetracycline-based antibiotic orally. In the U.S., that would be either minocycline or doxycycline. In the U.K., it could include limacycline. If a tetracycline antibiotic can't be used, then you can use either trimethoprim or macrolide. You can use topical azelaic acid alone with a tetracycline antibiotic. The initial course of treatment is considered to be 12 weeks, and then remember to see someone back, see how they're doing. You can, if needed, continue the antibiotic for another 12 weeks, but it's recommended not to continue antibiotics for more than 6 months in order to minimize the amount of antimicrobial resistance that develops. If someone has a good response, drop the antibiotic, continue with maintenance therapy. So you can either use fixed combination therapy with adapalene benzoyl peroxide, or topical monotherapy with adapalene benzoyl peroxide, or with azelaic acid as continuation maintenance therapy. If there's not sufficient response, switch to one of the different topical combinations that you used. And if you didn't use an oral antibiotic to start, you can add it at that point. With regard to oral contraceptives for acne, the guidelines state that there's not enough evidence of effectiveness. I do want to note that it is mentioned as effective in the 2016 American Academy of Dermatology guidelines, and there's a meta-analysis of 32 studies that was published in the Journal of the American Academy of Dermatology in 2014 that showed a reduction in inflammatory lesions by about 60%. So what do we do with that? I'd say that I'm not sure that I'd recommend oral contraceptives as primary treatment for acne, but if someone wants to be on an oral contraceptive for contraceptive use, we should expect to see improvement in their acne. Spironolactone is mentioned as benefiting women with PCOS. If a person's acne is severe and hasn't responded over a 3 to 6 month period of therapy, then consider referral to a dermatologist. primarily for consideration of isotretinoin or photodynamic therapy. This is a lot of really important information for something that we see commonly in the office. I'm Dr. Neil Skolnik, and this is Medscape.